Hello everyone and welcome to our presentation on mental health nursing. Today it will be me, Haley Graham, and my partner Shayal Sammy talking about what mental health nursing is, the job outlook in the field, what the day-to-day looks like, and a brief interview with a current mental health nurse. So first off, as I kind of mentioned already, our key points right now are looking at what mental health nursing really is, common mental health disorders that we see, and how to become a mental health nurse, as well as the pay and career outlook for a mental health nurse if you do so choose that path. In this slide, we're going to discuss what mental health nursing actually is. And so we know it's a specialized branch of nursing, much like many of the fields that we'll be talking about throughout these presentations. However, with this one, it is considered within the psychiatric and mental health realm and involves, more technically speaking, assessing, diagnosing, managing, and treating a wide array of mental health disorders, specifically and very commonly including schizophrenia, substance abuse, bipolar disorder, depression, and early onset dementia. This can vary depending on what kind of clinic or if you're working for a county, so whatever kind of facility you're in. So there may be a specific disorder that you're working with. However, this is generically speaking what mental health nursing is defined as. So first off, we'd like to start with how to become a mental health nurse. So we have created this video here for you to play. And essentially with this, you can see that we have Shayal talking to one of her coworkers who is an existing mental health nurse and who is in this field as it is. And so he has some experience as well that he'd like to share.
So the specialty in mental health nursing, there are a few different paths that you can take. There are different certifications at different levels to become a psychiatric nurse. Here at the county, I entered in as a staff nurse 1, which is just the most basic designation of a nurse. And that was because I had already done 7 years as a psych tech, so they knew that I had the experience with this client base so that I would be capable of performing in this environment. After getting hired on, the county gives you, I believe, might be the first year, they give you time in your first year to take a test administered by the county that gives you that designation of being a psychiatric nurse. So you don't necessarily have to be a licensed psychiatric nurse when you first start, but they will test you, and you have to pass that to continue your employment in the role of a psychiatric nurse.
And is this for just like the county or like hospital setting?
So this one is specifically for the behavioral health services side of nursing. It doesn't extend into, say, the San Joaquin County General Hospital. This is only in the behavioral health arm of the county services.
Here we can see a video about Shayal talking to her coworker again, really getting into what the job outlook and salary and day-to-day opportunities are within this field. Although Bureau of Labor and Statistics does not provide a very specific example of what the job outlook and salary is, we do have some references from Oppenheimer who report about an average of the salary being about $98,309 per year, with the job outlook of a 5% job increase, which is faster than average for most jobs, but pretty in line with all other nursing fields at this time.
So what are like the starting pay range for like a starting mental health nurse specialist, like someone in mental health nursing profession? Is
it okay if I take a look real quick?
Sure.
If I don't have it memorized, I know when I started, I was in, I believe, the high 40s an hour. However, I know that the pay scales change. Let me see real quick. Job descriptions for the county. So if we're just talking about, again, you come in as just a staff nurse. The designation between what we do here in outpatient and what they do at the hospital is we're ambulatory, they're considered inpatient. So there's a 5% pay difference between working at a clinic and working in the hospital. So specifically as when I started, it's $48.31 an hour. And then now I'm a staff nurse 3, and staff nurse 3 starts at $55.39 an hour. And then in each category, so staff nurse 1, 2, 3, 4, there are 5 steps per designation. So like a staff nurse 1 in their first year, second year, third year, fourth year, fifth year, it all depends on getting a satisfactory annual review to qualify you to go ahead and get your step progression from first year to second year, or step 1 to step 2. It usually corresponds with the amount of years that you've been here. However, if you don't meet a satisfactory evaluation, then you don't get that automatic step increase.
And with that, we'd like to thank you, and if you have any questions, feel free to contact us at this contact information provided here.